Guam.
Right.
Several are on receiving ICU level of care. I think it was 1 or 2 that's on a ventilator right now, and almost all of the patients that are hospitalized are unvaccinated. So let's not forget that. We can go on and debate, well, who gave the governor the advice to implement this, whether it's legal or not. But Chima, what are we looking at? You've always said the numbers tell a story.
Right.
Almost 300 in the past 3 days of positive cases. Do we have any more clusters that you guys can tell us about?
Yes, and yes. But what I want to make clear before we start is,
okay.
Yeah, we all are part of the decision that is made by the governor, and she's clear in the room what she wants, and we all accept it. So I just want to make that clear. So it's about us all being responsible and also making sure that the community is safe. Going back to what you said, we're actually seeing increases. So there are lots of little clusters going around. So we're having places where you have 5 cases, 6 cases, 7 cases. Like last time we talked about the bar, we talked about a boat cruise that had 12 cases. We're finding out that people from that boat cruise actually visited Mosas, and then we're also seeing that the musicians that played in Mosas were also in sidelines. So we're now seeing we have almost 108 cases that are linked to bars and wedding receptions. But you also look at the family unit too, and we're seeing cases in families where you're having 5 to 6 cases in families. So we're also having large number of cases in the family unit. So we are really in a place where there's community spread. But the good thing is that we're testing enough. We're actually isolating and quarantining a lot of people. We're seeing a decline in travel testing. Not like it's not as high as it used to be, but what we're noticing is that there's a huge increase in household testing. Not only at the Tizan site, but also at the local clinics. For the vaccinated and unvaccinated, we're still seeing a higher number of unvaccinated who are getting infected. So it is what is going on now. Yeah, we're seeing little clusters everywhere in families, in offices, where 3 or 4 people are infected at the same time.
Chima, let me just ask you right off the bat, if this executive order was in place a couple weeks ago, would we have seen this spread at these bars, at these social gatherings?
I would tell you it would have contributed a lot with us not having this number. Yes.
Yeah. Okay. So I gotta ask though, with the bars, right, and the large gatherings, those were the 2 places where we've seen from what you said coming on the show, where we've seen the clusters. So did public health at all recommend to the governor any specific restrictions targeting like bars, for example? Or was this you felt your recommendations that you guys made kind of address the surge and the clusters that we see?
Yeah, so I think the thing here is we're looking down, and then balancing the number of people vaccinated on the island and the consequences of the unvaccinated. So one clear example is we have a lot of vaccinated people on the island. So that means shutting down completely is not an option. But it's looking at how to manage, the situation that we have now with people still, moving around, with businesses open, with schools open. So if you look at the percentage of the vaccinated on the island, we're looking at almost 83% of adults. We're looking at almost 65% of our total population. This is for vaccinated and unvaccinated. So at this point, we're actually in a place where if we try to increase vaccination, make people who are vaccinated more comfortable in walking around and following the 3 Ws, I think the decisions that we're taking now is a better approach than what is happening in other jurisdictions where they have 1 or 2 cases, they are going back to full restriction, they are going back to full quarantine for inbound passengers. So I think it's balancing what level of vaccination that we have in the community and using that to guide us in our decisions.
Tom, I know we brought you on to kind of go over this EO, and I know your time's precious, so I do want to kind of to start with that, and then maybe we can come back to Chima on some of the contact tracing. Good morning, Tom.
Good morning, Chris. Good morning, Sabrina.
Right on.
Morning.
So this thing goes into effect in about 3 minutes, and we're just going to start with Tom. If you could just run through like the major provisions in the EO that people need to know about.
Sure. More than happy to. Just remind everyone that the executive order and our guidance, they do go in effect, like you said, in 3 minutes. However, it was commented that we won't be actively enforcing it until the 6th of September. So from today till then, we'll be focused on education.
I see. So what does that even mean? Does that mean that people need to start checking the vaccination status at 8 o'clock? Or does it mean we're not going to be enforcing it, so whatever?
Well, a lot of the stuff is based on, honor system, if you will, because essentially we are hoping and expecting businesses to comply. But we're there to assist along the way. We're not actively looking to cite. We're actively looking to educate, and only when they're refusing or there's a repeat violation that we actually go and issue citations. But if I could just make 2 points to Chima's comment, just to add. So this executive order and our guidance that came out, there are actually two main focus to this is one, to address those businesses where mask wearing is compromised, right, like doing eating and drinking, and also to address congregation. So those are the 2 real points of the executive order and our guidance document to help businesses understand, because we've been getting a lot of inquiries, like from the grocery store retailers saying, are we included? And the simple answer is no. Mask wearing is still required, and these are not your areas where masks are compromised, such as eating and drinking facilities. So I just want to make that clear. And to further along, Chris, to answer your question, so those businesses that are affected, that are mentioned in the executive order, and also repeated in our guidance document. And I'll just repeat this just so sake of I know it's repeating myself, but just to help those who are listening along. So boat cruises, bowling alleys, concerts, consumer events, eating, drinking establishment, as I mentioned, food courts at shopping centers, food services at funeral ceremony, gym, fitness center, dance studios, movie theaters, organized contact sports and competition, swimming pools, theaters, and museums. So if you notice, the commonality among all of them is there's a mass compromise or there's potential for congregation, and that's the reason why we had listed down explicitly.
I thought you guys were just trying to fun kill the unvaccinated.
Mm-hmm.
Oh, well, prevention is difficult, but, it's there to protect everyone.
Right, okay.
The boat cruises, are we talking about like the booze cruise? Are we talking about like
dolphin
watching, things like that? The charter fishing? Can you just make sure we're clear?
Sure. No, all of the above. If it's a commercial enterprise, obviously, it's a regulated business. And one of the reasons is they do serve food and drink on these activities. So there is mass compromise. So that's one of the reasons why we've included boat cruises as well.
So that's, again, fishing. If you're a charter fishing company, everybody has to be fully vaccinated. And then dolphin watching, anything that has to do with the boat, basically.
Yes.
Any commercial enterprise involving a boat.
A boat,
Right.
okay.
Yeah. Riverboat
But
cruise.
keep in mind, folks, but remember, congregation is prohibited unless it's among vaccinated individuals. So, like, I can hang out with my family, participate in sports, in fact, as a family, because we're all same household. if you plan to do the same, everyone in that group has to be fully vaccinated if you plan to have a congregation of non-family members or same household, provided it's less than 100 and they're fully vaccinated.
The other thing, so on I think it's on Thursday nights they have like that food truck rally. I'm not sure if they still have that down in Skinner Plaza.
Yeah.
Is that no longer allowable?
Or is there going to be like a bouncer that kind of checks people's?
Yeah, cards and stuff.
Well, it's up to the individual establishment or establishments or the organizer to determine how to address their particular needs. But it applies to everyone, whether you're a mobile food truck or physically brick and mortar establishment, if you will. You have to follow the mandates of the executive order.
Okay. And what about let's say these basketball clinics? For example, Elite has a basketball clinic and it's for children under 12 and teenagers. So what is the guidelines for them and other groups that hold sporting type of activities?
Sure. Let me make also a clarification. So the school guidance is separate and apart from this. This applies to all contact sports or non-contact sports that involve congregation, but it does not include school activities. They have their own guidance number that was issued, so separate and apart. So that clinic is part of the school activity. In other words, it is sanctioned by the school. It is actually part of the school practice, let's say. They just need to follow the school guidance. But outside of that, like the sports clinic you mentioned, held by a private organization, they need to abide by this by having everyone 12 and over show proof of vaccination.
So any sort of private contact sport providers, or if you're 12 and over, have to be vaccinated.
Correct. Any event, any congregation, you need to be fully vaccinated to participate.
And their employees and their staff. Correct.
Essentially everyone, yes, you're correct.
Okay. Can we just do a hypothetical real quick, Tom? Because we're having a conversation earlier about pregnant women, right? And so, a pregnant woman who works for a private business, just maybe a decision with the baby daddy that we don't want to take the vaccine or whatever. What's going to happen to that pregnant woman if she just doesn't want to take the vaccine, and what's going to happen to her employer if she doesn't want to take the vaccine?
That's an excellent question. Chima, you want to take that?
Yeah.
I'm kidding. No,
and then Tom will go back to the EO. Yeah.
I defer to Chima only because that is Division of Public Health.
Right. Yeah.
Pregnant women on that. So,
okay.
Okay, so the answer will be, we have exemptions. So if you have any reason to have a medical exemptions and you have the proper paperwork, then you'll be exempted. So there's a medical exemption for vaccines. So if a pregnant woman has any medical reasons for not wanting to vaccinate and presents that paperwork, then she'll be exempted from vaccination while she's pregnant.
Okay.
Yeah. So Grace, I just wanted to go back to the question you asked Tom, Sabrina, about the boat cruise. So, like Tom said, these are places where masks are compromised. But we're actually investigating a boat cruise that had almost 40 passengers in that boat cruise. And the interesting thing is that these individuals were actually sharing the mask, the snorkeling mask, without sanitization. So these guys are out in the sea. They have this cooler that is, how they fill up the coolers with the snorkeling face mask when you get in the ocean. So that was being shared amongst almost everyone in that boat cruise. Yeah. And this was done without sanitizing it. And in that boat cruise, we're seeing an uptick of cases. So transmission at that place is still high. With what Tom just described, and also this particular situation where you wear it and then you drop it off, somebody else takes it and wears it, without proper sanitization. So we're seeing also situations like that, and it's being reported to us too.
All right. I wanted to go back to the schools, Tom, because you mentioned that if it's a private company hosting a sporting training clinic or what have you, what is the difference if GDOE is holding sporting activities? How is that fair?
No, that is an excellent question. In fact, that's something we're looking internally as well. In fact, she wants to add to this. There is a internal group within public health that's looking into this as well. So it's possible it may change, but it may not. But like I said, it's still going on. They're undergoing discussion and internal review. But for now, we have a guidance that came out for school. And as we mentioned in the past, it's always open to revision and amendment. So that's something we're discussing internally as well. Chima, do you have any comments onto that?
Yes, like you said, Tom, for the school guidance, which was specifically researched and agreed upon by CDC and us here at Public Health, we work with the schools to produce that guidance. There are specific guidances for sports. So if you're looking at the school guidance, and that is what I've always pointed at, is for us to really look at the school guidance and step by step and understand how the school guidance is designed to provide protection for the students in school. So we have the screening testing component as part of the school guidance. We also have the guidance for spectatorship in the school guidance. We also have the vaccine component for the school guidance. So for the school, their guidance actually addresses every activity, every encounter that would go on in the school, and all this is designed to keep the students safe. But for what Tom is describing as outside entities, those ones are different from the schools. So it's just trying to understand, what the school guidance, is meant to do. This is for these individuals when they are in school, and the guidance for the other contact sport when they're outside is different. So it's just different guidances for different circumstances.
Right, but doesn't public health approve both for public schools or private schools or whatever, in schools and for the private sector? Don't they approve the same guidelines? I mean, at the end of the day, public health has the final say.
Let me describe a situation for you here. So, let's say if you're in Harvest and you follow the school guidance and you're going to compete with FD and they follow the same guidance, right? So this is the school guidance, which means every layered approach is followed every day in these schools. But if you are going to play sports on the weekend, you're seeing individuals from different households, different schools, training in a different club, and then coming to meet individuals from the same, mixture of families and schools. So those scenarios are basically different in the sense that in the school guidance, we recommend testing for athletes. We recommend the teachers to be vaccinated. So for the outside sports, for the outside organized sports, we're also making that recommendations for them. But we can't put that recommendation in the school guidance because the school guidance is basically, addressed to opening the schools and showing. It has guidances about what they should do in class, what they should do in the dining. So it's just taking the sports component that is in the school guidance and making it part of this other guidance. So that when you're looking at the school guidance, it's complete on its own, and then when you're looking at this EO, it's complete on its own. So we don't want people jumping from one guidance to another guidance. So the school guidance actually addresses everything about schools in that guidance.
Should we just have one sports guidance? So there's not all this confusion?
I don't think
It's
there's
not possible.
confusion.
Sabrina, to comment on to expand on Chima's comment, what he's trying to say is at a school setting, you have a much more controlled settings, and the participants are known among each other, and I guess you could say because they're all students, same cohort within the same school, they're easier to, I guess, maintain and control in terms of their behavior, if you will, because it's from the entire day, right? Not just a particular event, which you mentioned about some private organized sport. I think the setting is different. I think the scenario is different, and I think that's why they have separate, distinct requirements. I think it comes down to the layered mitigation effort that's required for schools, which is much more, I guess, more organized and more, I don't want to say strict, but definitely more requirements, if you will, at a school setting than, let's say, some one-day event or clinic. So I think that's what Chima was saying, that I think school setting is a bit different than a private one-day event or two-day event.
Okay, so just for clarification, if I play football for Simon Sanchez High School, it doesn't matter if I'm vaccinated or not.
Oh, the question is, currently, I'll make sure I get this right. So currently the school requirements for extracurricular activities is essentially just make sure they wear a mask when not actively participating and they maintain 6 foot distancing. Vaccination is not addressed so currently at this time for school activities. You're correct.
But if I
if she plays for the MFL youth league, then you have to be vaccinated.
Yes, based on the current mandates, yes, you're correct.
Okay.
Let me just ask about this because there was some I was confused about it. So, in the governor's vaccine mandate for government employees, if they're not vaccinated by the deadline that she sent, are they still able to just do the weekly negative test? And then, what's the status for private sector employees? Like, if they don't meet the governor's deadline, are they also able to present the negative weekly test, or am I just confused about this?
Yeah, so I think one of the reporters on Friday was actually asking the same question, and I think it didn't come out the way you just put it straight. So that was one of those things that I described, that when you write this guidances, there are some things that you might miss, and some things you might how do I describe it? But that is one thing that came up that was not addressed at that press conference, that is going to be addressed in the guidance. So, like I said, if there are things that we notice that are not in that guidance, we go back and make sure that those things are added up. So your point is well taken, because it wasn't addressed at that point, but it's going to be addressed.
What about spectators? Do spectators at school sporting events have to be all fully vaccinated?
That is one of the issues that's ongoing further discussion internally. But currently, as it stands, because like I said, school requirements are different than the recent executive order and the guidance. Currently, there is no vaccination mandate for spectators for school events. But that's definitely one item that's on top of our list to further review.
But if it's a private sector holding a sporting event, they must be fully vaccinated, and the maximum is 100.
Yes.
You're correct.
Oh boy. Okay.
So do you guys have people? I mean, I know you're not enforcing it until September 6th. By the way, guys, it's been 14 minutes under the purge. But are you guys going to have people out like anytime before September 6th to maybe just kind of be like, okay, this is how we're doing it, or whatever?
Right. So we've been going out every day, and I think almost every evening to ensure compliance. So from today till the actual enforcement, there'll be a lot of education specific to the current executive order. But remember, there's still other mandate that's been always in place. That's the face mask wearing, hand washing, and along the respiratory etiquettes. So there's something that we actively enforce anyway. But in terms of the recent guidance regarding vaccination, that's something we'll go through the education and start actively enforcing it come September 6th.
And churches, just to clarify, churches are as is. You can be unvaccinated, vaccinated, whatever. You can go to church.
Right. Church is not listed as one of those quote unquote covered establishments, so they're not on the list of requiring full vaccination.
So we're not concerned about the removal of the mask for the communion. That's all good.
Well, there's a balance. That's something that I think there's a balance. It's minimal, we believe, but it's finding that balance.
There was a question actually that was brought up during the press conference from one of our media colleagues, and I'm not sure it got like a straight answer on it, but how does this apply to the tourists that are coming in under Airbnb?
Okay, I think I addressed that situation. I think I did because
well, the Gov said that it applies to tourists that come in. They
And
can't go to
military.
the restaurant. Yeah, and military. They can't go to the restaurants. They can't go anywhere that are within the executive order. So
yes, but what I explained at the press conference was the public health guidance for inbound travelers on the island. I think a few months ago, actually addressed the issue of tourists coming into Guam. Initially, we had only FDA approved vaccines for people coming into Guam, but that was changed to also accommodate the WHO emergency use listing vaccines, so that countries that are using AstraZeneca and other vaccines that are approved by the WHO can actually come into the island. Then another thing is that the Airbnb is actually a program that is designed to attract people who want to get vaccinated coming to Guam. So, and like you said, the Airbnb is actually targeted at unvaccinated people who come in here with a negative test result, get their vaccination, and then go back to their countries. And if there is any need to actually look into, not any need. I think what the point that you brought up is what we really need to look into, if there is a way to accommodate, those that come into the island with the Airbnb program. So I think it's us distinguishing tourism and the Airbnb program, and also looking at it in relationship to the new vaccine mandate. That is a point that we would also have to look into and address. But right now, like the governor said, it stands until is reviewed.
okay, so tourists that are currently here, waiting to be fully vaccinated, it's takeout, right? You cannot go to the restaurant. You
That's
cannot.
what it should be, yes.
Okay. And in terms of tourists that are coming here, that aren't vaccinated, it is, but they have a negative test. It's just again straight to the hotel until they're fully vaccinated and get the VIP card, and they can go out. So.
Yes.
And then you guys are going to probably work on another guideline to address this?
Yeah, so that's what I said. Like the points Dr. Wen brought up were, so we're looking at what exactly, what exactly that we need to discuss is not rescinding the whole EO, right? Is looking at, those gray areas that need further discussion. And if we discuss those gray areas, then we're going to make those changes to address that. And I think that has been the way we've been going. You've seen us, have guidances, and then we update those guidances. And this comes from, information. This comes from new science. This comes from a better understanding of the circumstance. And remember, the virus keeps changing. The circumstances keep changing. So while we are working hard enough to try to mitigate spread in the community, we also look at the guidances that we put out and make sure that they match what is going on in the community. So the issue of the Airbnb, like was brought up, is something that we also have to look at deeply, and if there's a need to make changes right away, we make changes. But if the same circumstance that we have now is the same, we will keep with the governor's EO's mandate. So that is it. But like I said, the WHO EUL actually allows fully vaccinated tourists to come into Guam. So that restriction was lifted from only FDA approved vaccines to WHO EUL approved vaccines. So that we just have that in perspective while we discuss tourism.
Okay. If you're fully vaccinated, you can come in. If you're not fully vaccinated, you're in lockdown in the hotel. And somebody asked about pools. No, you cannot use the pool if you're not fully vaccinated. I did want to also ask Chima, how do people go about getting these exemptions?
Yeah.
Is
Religious,
there
medical.
Do they get it from their doctor? They get it from the church?
And who approves it and all.
Is there a standard format you can download on the public health website?
So there has always been, the exemption has been there for a very long time, especially for school vaccines, right? So with the school vaccines, they actually get a doctor's report, or you get a letter that is notarized, and then you send it to the immunization program. The immunization program will review it and send it up to the Office of Chief of Public Health, that will review and sign off on it, with the authority of the director. So that is going to be published on our website, for this mandate that we have now. So it's a process that has been there, but it has always been for school-age children, and the process remains the same. But now that we are having a mandate for the whole community, what is going to happen is put it out there so that people will know exactly, what requirements that we need.
Okay, so it's not yet available on DPHSS's website, but it will be for this new executive order.
No, what I'm saying is that it has been there for the school age kids. Yes,
right.
Yeah. So it's been there, but now is we're standing above school age kids. So it's just to update it and put it out there too.
All right.
Thank you. I know you guys got the big meeting with the Gov at 8:30. Any hints?
I'm sorry, I had one more question.
Yeah.
If you lost your vaccination card, where do you go?
That's why you do this.
How can you get another one?
Okay. There was a guidance that was put out last night, and I can what it is it should be out there now. So we have a phone number. To request for a replacement COVID-19 vaccine record card, residents can contact the immunization program by calling 671-735-7143. And this will be between the hours of 8 a.m. to 5 p.m. Monday through Friday. And we're also asking, because we don't know how many people who lost their cards, so I think that the lines would definitely be busy. So we're providing an email address, publichealth@dphss.guam.gov. And this will be an email address that will be dedicated for now for people who want to request for their vaccine cards. So they can send an email to this address, but we're asking them to please write in the subject line, vaccine card replacement request, so that we can actually identify those who are asking for vaccine card replacement, and we're able to, take care of their request. And in the body of the email, they should include their full names and their date of birth, and the date and location of their vaccine, if they can remember it. That will be very important. And then we're also looking at pickup times for those replacement cards. It's going to be from 9 a.m., I think 9 a.m. to 3 p.m., Monday to Friday, at the Division of General Administration Office at Hagania at 155 Hessler Place. So to pick that up, the individuals would have to have their government-issued identification, and they will get their replacement card. So I think, and we're also saying that they should allow us 5 business days for pickup. So if you make your request, it's going to take 5 business days for you to pick up your card.
Okay. So if you're in that category, you're going to have to order takeout. All right. So. You cannot go and
Can't go
eat
in.
in
They
a
heard that a
restaurant.
million times. Oh, I lost my vaccine card. Yeah, okay, tell it to the judge.
Can you vaccinate that vaccination? I mean, not vaccinate, laminate that vaccination card? People are asking.
No, so yeah, I think if you might need to, I don't think is encouraged, because if you
darn it.
need to update your card, it has to be the same card. So
Sorry.
if you laminate it, will be difficult.
Yeah.
But what I want to put out there, before we end, is that I think we're all in agreement that the park and public health, we've worked together as a team to make recommendations to the governor, and we appreciate the effort of the park group and their contributions, and we also look forward to continue working with them, to continue providing recommendations to the governor, so that it's clear that we are still in partnership, and we're all doing this to make sure that the island remains safe. Thank you.
Thanks, Chima.
Chima,
Thanks, Tom.
so you guys are reviewing the religious exemptions too at that email you mentioned?
Yes.
Okay.
Do you guys have the final say on the religious exemption?
So, is actually you notifying us that you have a religious exemption, and then we put it on record that you're not vaccinated based on your religious exemption.
Okay. I was
Is
going to say, you guys are going to approve.
Yeah. Is there a fine because I
No,
laminated
we're
my...
just documenting the fact.
Right, yeah. Chima, is there a fine because I laminated my vaccination card?
Is it?
Am I going to get fined for laminating my vaccination card?
I can't hear you.
Okay.
Okay, so then let me just ask, if I have an exemption and can I still go into a restaurant if I am granted an exemption?
If Sabrina has an exemption due to her religious or medical whatever, is she allowed to go dine in with the clean people, the vaccinated persons?
Yeah, there's a reason for the exemption, and that exemption is clear that you are not vaccinated for either a medical or religious reason, and then you'll be allowed to dine in. But at the same time, you're also mandated to wear your mask and follow all the other recommendations. Yeah.
Okay, you might want to let 311 know that, because they're telling people
Yeah.
that even if you have an exemption, you have to be vaccinated to dine in. Sorry.
Yeah, because we actually had a call from a lady over the weekend, Chima, who has a medical exemption, and she was informed by calling 311
Yeah, and they
that
told
she
her.
would not be allowed to dine in.
All right, we'll clarify that. Thank you.
Thank you so much. It's 8:28. You good?
Just one more thing.
Okay.
The exemption thing. Does it have to be some sort of a formal record from public health in order to?
Yes.
Yeah.
Okay,
You
I just
just-
want to make sure. So we send in the email once you guys stand it up, and then you send it back, and that's what we're going to show as my exemption. It's
Okay.
not like I got a letter and it was notarized from my church. It
Yeah.
has to be from public health, with
Right.
the public health letterhead.
No, you're gonna write us and let us know what are your
Right,
reasons for
but when I go to
exemption.
the restaurant with my exemption, I have to have the official public health. This person's okay.
Exemption.
Yes.
Okay.
Yes. Okay.
Tom, thank you.
Thank you.
Thanks, Tom. Thanks, Chima.
Thank you, Chima. All right, it's 8:29. We have to go to Lillian Posadas for our Guam Memorial Hospital.